The amygdala is a key brain structure involved in processing emotions. It constantly monitors incoming sensory information for potential threats. The amygdala acts as an early warning system for danger. When a stimulus resembles a past threat, the amygdala activates. This activation triggers a rapid fear response in the body. This response prepares the individual to react to the perceived danger. Sensory information rapidly travels to the amygdala for quick processing. This rapid processing allows immediate reactions to perceived dangers. Reactions occur even before conscious awareness of the threat. This mechanism is crucial for survival, enabling fast responses to threats. The hippocampus retrieves memories of similar past experiences. These retrieved memories are related to previous events. These memories can amplify the amygdala's anxiety response. This amplification leads to a stronger overall anxiety reaction. The prefrontal cortex assesses the actual level of threat. This evaluation determines the appropriate response to perceived danger. If the threat is minimal, the prefrontal cortex intervenes. It can dampen the amygdala's response, reducing fear. This cognitive control helps regulate emotional reactions. The amygdala plays a key role in threat perception and triggering the anxiety response. The prefrontal cortex regulates the amygdala, modulating the intensity of anxiety. When the amygdala perceives high threat, it signals a strong anxiety response. If the prefrontal cortex fails to effectively regulate the amygdala's activity, anxiety levels can escalate rapidly, leading to heightened distress. Anxiety triggers physiological responses in the body. These responses include an increased heart rate. Rapid breathing is another common reaction. Muscle tension also increases during anxiety. These changes prepare the body for fight or flight. The autonomic nervous system has two branches, sympathetic and parasympathetic. The sympathetic branch is activated during stress or perceived danger. Activation leads to the release of stress hormones into the bloodstream. These stress hormones released include cortisol and adrenaline. These hormones prepare the body for fight or flight responses. Cortisol and adrenaline are hormones released in response to stress. These hormones increase alertness and boost energy levels. However, they can also induce feelings of unease. Cortisol and adrenaline may lead to hypervigilance. This heightened state of alertness can be both beneficial and detrimental. A feedback loop in anxiety involves a cyclical process. It starts with initial anxiety, triggering physiological symptoms. These symptoms may include increased heart rate or shortness of breath. The physiological symptoms then amplify the initial anxiety. This creates a cycle of escalating fear and physical discomfort. The feedback loop reinforces and intensifies the anxiety experience. Environmental cues can trigger anxiety. Crowded spaces can be a trigger. Specific sounds may also induce anxiety. These triggers are often linked to past stressful events. The association creates a conditioned anxiety response. Avoidance or management strategies can help mitigate these triggers. Negative thoughts can trigger anxiety. Catastrophic interpretations of events also contribute. These interpretations activate the amygdala. The amygdala is key to the anxiety response. Amygdala activation initiates anxiety symptoms. Thus, thoughts directly influence anxiety levels. Early life experiences, especially traumas, can significantly impact brain development. These experiences can sensitize the amygdala, a key brain region for processing emotions. A sensitized amygdala becomes more reactive to perceived threats later in life. This heightened reactivity can lead to increased anxiety and fear responses. Thus, early experiences shape emotional regulation and threat perception in adulthood. Genetic factors can influence the amygdala, a key brain region for processing emotions. These genetic influences can affect both the size and reactivity of the amygdala. Individuals may inherit a predisposition to a larger or more reactive amygdala. This predisposition can lead to higher baseline levels of anxiety in some people. Neurotransmitters are crucial for regulating brain functions, including anxiety levels. Imbalances in neurotransmitters can disrupt the brain's ability to manage anxiety. Serotonin and GABA are key neurotransmitters involved in anxiety regulation. Deficiencies or excesses in these neurotransmitters can lead to anxiety disorders. Restoring balance can improve anxiety management and overall mental well-being. Sleep deprivation affects the brain's prefrontal cortex. The prefrontal cortex regulates the amygdala. The amygdala is responsible for processing emotions. Lack of sleep impairs prefrontal cortex function. This impairment reduces regulation of the amygdala. Increased amygdala activity heightens anxiety vulnerability. Chronic stress leads to elevated baseline cortisol levels in the body. Increased cortisol levels affect the amygdala, a brain region processing emotions. The amygdala becomes more sensitive and reactive to perceived threats. This heightened sensitivity can amplify the stress response to potential dangers. Cognitive biases can skew how we perceive threats. Focusing on negative info is a common cognitive bias. This negativity bias can intensify anxiety responses. Biased threat perception amplifies anxiety levels. Avoidance behavior offers short-term anxiety relief. This relief reinforces the avoidance as a coping mechanism. However, avoidance strengthens the underlying fear. The anxiety trigger remains unaddressed and potent. Long-term, avoidance can worsen anxiety disorders. Mindfulness enhances awareness of thoughts and feelings. It encourages a non-judgmental observation of one's inner state. This practice reduces reactivity to anxiety triggers. Mindfulness promotes a more balanced, emotional response. Cognitive restructuring is a therapeutic technique. It focuses on identifying negative thought patterns. These patterns are then challenged for accuracy. The goal is to replace negative thoughts. Replacement involves more realistic perspectives. This leads to a more balanced cognitive outlook. Exposure therapy helps individuals confront feared situations in a controlled setting. It creates a safe environment to gradually face and manage anxiety triggers. Repeated exposure reduces the anxiety associated with the feared stimuli. This process helps patients develop coping mechanisms and reduce avoidance behaviors. Relaxation techniques help reduce the body's anxiety response. Deep breathing is a simple and effective relaxation method. Progressive muscle relaxation reduces tension throughout the body. These techniques promote calmness by addressing physiological symptoms. Strong social support offers emotional comfort during anxiety. Support networks help alleviate feelings of isolation. This support can improve mental well-being. Social connections foster a sense of belonging. These relationships are key for managing anxiety. Lifestyle adjustments can significantly impact mood and anxiety levels. Regular exercise is a key component in improving overall mood. A balanced diet provides essential nutrients for mental well-being. Limiting caffeine intake can reduce anxiety vulnerability. Reducing alcohol consumption also helps in managing anxiety. These adjustments promote a more stable and positive emotional state. Medication can help regulate neurotransmitter imbalances. This regulation can reduce the severity of anxiety symptoms. Medication is considered when imbalances contribute to anxiety. It aims to stabilize brain chemistry for symptom relief. Consult a healthcare professional for medication options.